Na zaproszenie firmy ITPSA, wyłącznego dystrybutora Alma Lasers, przyjechał do Polski profesor Samy Nitecki, który będzie prezentował metodę VascuLife oraz szkolił polskich lekarzy właśnie z tej metody. VascuLife jest to laser, który służy do wewnętrznego zamykania żylaków.
The problem with veins is that in order for them to work properly, the blood has to flow from the legs to our heart and lungs against the power of gravitation. So in order to fulfill this job, we have every 10 centimeters valves, one-way valves, that will allow the blood to flow from below upwards and not fall down. And these valves may malfunction in women due to genetics and deliveries, and in males also due to the genetics, not deliveries, of course. So what happens when the valves malfunction, blood is flowing to the heart and lungs, but some of it stays in our legs. And there is enlargement of the veins, and after some time you can see them, and you call them varicose veins. You see the large veins. But it is a medical problem more than aesthetic problem. It causes itching and pain, and especially some kind of tiredness in the legs. So you cannot stand in one spot for many minutes because you feel that you need to move them, and so on. And after many years, you can get infections, you can get bleeding, and you can get wounds that we call ulcus cruris. And of course, it's a medical problem, you need to treat it. The advantage of laser, especially the one that I'm working with, the Alma laser, is its quickness. It works very fast at 4 millimeters per second, and it has a radial fiber that hits the vein all around, surrounding 360 degrees, and a coupling device of pullback. You start lysing, activating the laser in the groin, and then you have to pull it back to the point of entrance that is in the upper third of the calf or mid-calf. So what is important is the amount of energy that you omit while pulling it back. Beautiful effect and advantage of the Alma laser is that the pullback device is a smart one that is coupled to the work of the laser, and you can either change the speed that you want to pull it back or change the amount of energy. Another way to do it is to set the time for it. You can stop it every 3 seconds, every 5 seconds. So there's a lot of variety of choices that the surgeon that is treating the patients can do. And this is all to the benefit of the patient, to have a better result and so more satisfactory results for the patients. Basically, it is an office-based treatment. You can do it in an operation room, but it's basically an office-based treatment. So the patients come in, no really many preparations are needed. Basic blood test, and we ask the patient not to put any creams on the legs. That's it. Then the patient is standing in front of us. We mark the places that we want to go in with the laser. Then the patient lies down on the bed. First, legs down, because we want the veins to be full with blood and large. Then we puncture the vein from below. No cuts, only like a blood test. A needle goes in. Through that needle, we put in the laser fiber. We move up to the groin level. Then, when we are in there, we move the position into legs up because we want the veins to be with less blood and smaller caliber. And according to the caliber of the vein, we decide what amount of energy we want to supply. Then we do what we call Tumescent Anesthesia. We do injections of anesthetic treatment like lidocaine, something very, very easy. And then we make sure that the vein is completely separated from the surrounding tissues. Like if this is the vein, we do local anesthesia, local anesthesia, local anesthesia, local anesthesia. We get a separated vein from the surrounding tissues, and then we start lysing, activating the laser, and it pulls back from the groin downwards. We finish this thing on, we wrap the leg with elastic stockings for a week, and that's it. The patient should start walking for 20 to 30 minutes after the procedure before he goes home. Back to work next day. The first benefit is medical. You treat bad veins, so the patient will feel easy to stand, not feel the itching that there were before or the pain. It prevents later complications such as thrombophlebitis infection, such as bleeding, or such as ulcus cruris, a wound that takes a long time to heal. The second benefit is the cosmetic one, because several months after this treatment, the leg will be nice. There will be no humps and bumps of the varicosities. And Alma laser gives an excellent result. The laser treatment, or what we call thermal ablation by laser, can be done in any size of vein. What you need is only a vein that is straight, that you can put in the fiber. Once the fiber is in, you can treat any vein. The difference between very large veins and small veins is the amount of energy you need to treat the vein. You can do it in an 80-year-old patient, and you can do it on a 16-year-old patient. And I remember a lady, 85-year-old lady, with a large ulcus cruris, a wound that doesn't heal. She suffered a lot of pain. She was in agony, and she had all kinds of treatments. You can treat the wound, it will heal after 4 months, but then another wound would open because the main problem is the large veins and the high pressure that is around the ankle. And I suggested to her to go treatment with Alma laser, which she did, and guess what? 5 weeks after the treatment, the wound healed. And it was several years ago, and every year I get a card from her saying, "Thank you, because I can walk, I don't feel any pain, and I don't have any wound." And this is the way we would like to help people. But we cannot wait till the wound, we have to treat them earlier. For me, it's very, very important to come here to Warsaw, because many years ago, I was born 100 kilometers away in Łódź. Ja się urodziłem w Łodzi. Thank you very much for listening.